What causes vomiting during pregnancy? Vomiting during pregnancy, also known as morning sickness, is a common symptom that affects many women during the early stages of pregnancy. It is characterized by feelings of nausea and the urge to vomit. While the exact cause of morning sickness is not fully understood, it is believed to be a combination of hormonal changes and other factors. Please be aware that everything discussed in this video is unbiased, verified with facts, and approved by a licensed healthcare specialist before we proceed. The purpose of this video is to examine the numerous vomiting causes during pregnancy and throw light on the elements that lead to the condition's emergence. In light of that, let's start by talking about the causes of vomiting during pregnancy. Number 1. Hormonal changes. Pregnancy causes major hormonal alterations as the body adapts to support fetal development. Hormone levels such as human chorionic gonadotropin or HCG and estrogen are thought to contribute to morning sickness. These hormonal changes might have an impact on the gastrointestinal tract, resulting in nausea and vomiting. While these specific mechanisms are unknown, it is suspected that HCG may stimulate the region of the brain that controls nausea and vomiting, whereas estrogen may impact the sensitivity of the digestive tract. 2. Sensitivity to smells. Many pregnant women have increased olfactory sensitivity, often known as hyperosmia. Because of this enhanced sensitivity to odors, some odors such as cooking aromas, perfumes, or cleaning agents might be overbearing and nauseating. The precise cause of this sensitivity is unknown, however, it is thought to be related to hormonal changes during pregnancy. Number 3. Sensitivity to certain foods. Food aversions are prevalent during pregnancy, especially in the first trimester. Pregnant women may develop aversions to certain meals or feel nausea and vomiting after consuming them. This aversion could be a defensive mechanism to avoid potentially dangerous substances, or it could be a reaction to changes in taste and smell perception during pregnancy. 4. Increased stomach acid. Hormonal changes during pregnancy can relax the muscles that govern the passage of stomach acid, resulting in an increase in acid production. Higher amounts of stomach acid might irritate the stomach lining, resulting in nausea and vomiting. The relaxation of the muscles may also hinder the emptying of the stomach, allowing acid to linger in the stomach for extended periods of time, contributing to these symptoms. 5. Stress and fatigue. Pregnancy can be physically and emotionally taxing, resulting in increased stress and exhaustion. These variables can interfere with the regular functioning of the digestive system, making pregnant women more prone to morning sickness symptoms. Stress chemicals such as cortisol can impair gastrointestinal motility and contribute to nausea and vomiting. Additionally, tiredness and changes in sleep patterns can have an impact on general well-being and increase pregnancy-related symptoms. Number 6. Rapidly rising blood sugar levels. According to several research, increased blood sugar levels, particularly after consuming foods high in sugar or starch, can contribute to nausea and vomiting during pregnancy. Rapid blood sugar rises can have an impact on the digestive tract and cause gastrointestinal pain. Managing blood sugar levels with a balanced and nutritious diet, as recommended by healthcare specialists, may help ease these symptoms. 7. Multiple pregnancies. Pregnant women carrying multiple kids, such as twins or triplets, are more likely to suffer from severe morning sickness than those carrying a single fetus. The increased fetal mass and hormonal load associated with numerous pregnancies might exert additional pressure on the mother's body. Higher quantities of hormones, particularly HCG, may be produced in multiple pregnancies, contributing to more pronounced nausea and vomiting. 8. History of motion sickness or migraines. Women who have a history of motion sickness or migraines are more likely to have nausea and vomiting during pregnancy. Morning sickness symptoms might be affected by the same underlying reasons that cause motion sickness or migraines, such as sensory sensitivity or hormone abnormalities. Women who are predisposed to certain diseases may experience more intense or frequent episodes of vomiting during pregnancy as a result of these underlying issues. 9. Genetic factors. Genetics, according to research, may play a role in the likelihood of having morning sickness. Women who have a family history of severe morning sickness are more likely to suffer from it themselves. Genetic factors can impact how the body processes hormones or neurotransmitters involved in nausea and vomiting regulation. The specific genes implicated in morning sickness are constantly being investigated in order to better understand their impact. 10. Gastrointestinal changes. Pregnancy causes changes in the gastrointestinal system to suit the developing fetus. These changes include increasing amounts of progesterone, which relaxes smooth muscles, including those in the digestive tract. This relaxation can cause nausea and vomiting by slowing the passage of food through the stomach and intestines. Furthermore, the expanding uterus can put pressure on the stomach, generating a feeling of fullness and leading to nausea. 11. Elevated progesterone levels. Morning sickness is a condition that can be exacerbated by progesterone, a hormone that is essential for maintaining pregnancy. The digestive tract smooth muscles and all other body smooth muscles are relaxed by it. As a result of the slowed food flow and the greater sensitivity to stomach acid, which can cause nausea and vomiting, this relaxation may delay gastric emptying. 12. Psychological factors. The presence or severity of morning sickness symptoms may be influenced by emotional factors such as anxiety, stress, or psychological distress. Mood and emotions may be impacted by pregnancy-related hormonal changes. Stress may be more difficult for certain women to handle, and this greater sensitivity might cause or make nausea and vomiting worse. Relaxation methods, counseling, or support groups can all be used to manage stress, which may help reduce symptoms. 13. Vitamin B6 deficiency. According to studies, a lack of vitamin B6 or pyridoxine may be a factor in the more severe manifestations of morning sickness. A few neurotransmitters that control nausea and vomiting are implicated in the metabolism of vitamin B6. Under the guidance of a doctor, vitamin B6 supplements may help some pregnant women with their symptoms. Before beginning any supplementation, though, it's imperative to speak with a medical expert. 14. Physical factors. Morning sickness symptoms might be influenced by specific physical variables. For example, a woman may be more likely to have nausea and vomiting during pregnancy if she has a sensitive gag reflex or a history of gastrointestinal problems such as acid reflux or gastritis. The body's reaction to typical hormonal shifts and gastrointestinal processes can be amplified by these physical variables. 15. Increased blood flow to the uterus. The circulation and blood volume in a pregnant woman significantly rise to support the growing fetus. The stomach's normal operation can be impacted by this increased blood flow, which is mainly directed toward the uterus. The digestive system can get disturbed and cause nausea and vomiting as a result of the changed blood flow and hormonal changes. 16. Thyroid dysfunction. Certain thyroid conditions such as hyperthyroidism or hypothyroidism can occasionally exacerbate the symptoms of morning sickness. The regulation of metabolism and other body processes is greatly influenced by thyroid hormones. Vomiting and nausea may result from a thyroid gland being hyperactive, hyperthyroidism, or underactive, hypothyroidism, which can upset the hormonal balance. And last but not the least, 17. Vitamin D deficiency. A low in vitamin D may be associated with more severe morning sickness symptoms according to some studies. In order to regulate the immune system and produce hormones among other biological processes, adequate vitamin D levels are crucial. The link between a vitamin D deficit and morning sickness needs to be proven, however, and more research is required. It's crucial to keep in mind that the morning sickness usually comes in the first trimester of pregnancy, but in some people, it might linger or last the entire time of pregnancy. The actual reason for vomiting during pregnancy and each person's experiences can differ, despite the fact that the factors outlined above give some insight into potential triggers. It's crucial to keep in mind that morning sickness usually comes in the first trimester of pregnancy, but in some people, it might linger or last the entire time of pregnancy. The actual reason for vomiting during pregnancy and each person's experiences can differ, despite the fact that the factors outlined give some insight into potential triggers. If you are having severe or persistent vomiting while pregnant, it is advised to speak with a healthcare expert for a thorough evaluation and individualized management plan. In order to treat your symptoms and protect both you and your unborn child's health, they can offer the proper advice, suggest lifestyle changes, and, if required, prescribe drugs. As always, we care about your health. If you enjoyed watching Vital Health TV and learned something from this video, help us make this video the record holder for likes on our channel. Your likes show support and help YouTube recognize the video's relevance, leading to a wider distribution and an increased awareness. If you haven't subscribed to our channel yet, we invite you to do so and activate the notification bell to stay updated with our latest content. Additionally, please share this valuable knowledge video with your friends and family, spreading awareness and empowering others with important information. Together, we can make a difference and create a positive impact. You can also tweak things out. Thanks for watching.